Hi everyone! In this video, we'll be explaining when and how to use a partograph and to respond to the information it gives. This is a partograph. It is a simple chart which plots observation made during labor. It is used in both basic and comprehensive maternity units across the world. The partograph was developed in Africa and is recommended by the World Health Organization. The partograph enables health workers to plot the woman's progress and make decisions and whether interventions need to be made. Correct users can also prevent prolonged labor and may also save the life of a woman and her unborn child. As these interventions are identical to the observations always made during labor, they should not lead to any extra work. It just requires that these observations are entered on the partograph. First, it is very important to have a supplies of partograph in your maternity units or center. If the stock is running low, you can make some photocopies. It is very important to observe a woman closely throughout her labor. This will include vagina examinations to assess cervical dilatation and descent of the baby head. Labor is the highest risk time of a baby's life, and it is crucial to be diligent at this time. You should start using a partograph when a woman is having irregular contractions. You make this assessment by observing the woman and carrying out a vaginal examination. If the woman is less than 4 cm dilated, then you are not ready to start using a partograph. The partograph should contain all the information needed to care for the woman and safely deliver the baby. As you can see, there is a color coding. For the green line, that means active or normal labor. For the yellow line, that means alert. And for the pink, that means actions. So upon admission, you are going to eye the patient. When the cervix is at 4 cm, you are going to plot by putting an X in between the green and a yellow line. The action line is parallel at 4 hours to the right of the alert line. If the woman's labor is not following the expected course, after 4 hours, the plot of her labor will begin to approach the action line, signaling to take action. This may involve making arrangements to transfer the woman to a better equipped facility before she crosses the action line, if it is going to take several hours to take her there. And you may also need to fill the other information in the partograph. Record the color of the amniotic fluid every vaginal examination and note the color using this key. Capital I, membranes intact. Capital R, membranes ruptured. If the membranes have ruptured, note the color whether they are clear fluid, and you can use capital C. And if it is meconium stain, and you can use capital M. If it is blood stain, you can use B. You should include the date and time of rupture of membranes if known, as this has implications for sepsis. And also record if how many cm the cervix of the mother. For example, 4 cm, then you may write 4 cm. Next is delivery of placenta. Record the time when placenta out. And the last one is oxytocin. Record the time when you give the medication after the placenta out. And this is all you can write in the partograph. Thank you guys for watching. I hope you may now know how to write on a partograph when assessing a woman during labor.